My name is Alan Pace, and I'm a manager at Applebee's here in Brookings. I've been a manager up here since we opened up for 13 years ago. Before that, I was a manager in Sioux Falls and Spearfish, and before that, a bartender for Applebee's in Sioux Falls. I presently live in Aurora, where I'm also a member of the City Council and president of the City Council of Aurora. But when I was raising my hand, I couldn't, on my right eye, from right here, I couldn't, if it was like below the top of my head, I couldn't see that. Or from right here, I wouldn't be able to see my hand. And then now it's like I can still see it, can still see it, can still see it, can still see it. And I had to when I was taking pictures, I had to be conscious about making sure my eyes were open, because if not, it would be just like this. So yeah, it definitely affected my vision. I had Dr. Minton from Yorkshire Eye Clinic did a bilateral ptosis, which was my tendon on my right eyelid had come completely detached from the cartilage, so it's causing my eyelid not to open all the way. It was actually half closed. He knew right away what was wrong. He looked at me, had me do some tests, some movements of the eyes and all that and whatnot. And then he had also discovered, because it was quite telling on the right eye, on the left eye you couldn't tell, but he could tell by looking at it that it was already, that my tendon was starting to become detached from the cartilage on my left eye as well. So what they did, he went in and I was under local anesthesia because I still had to be awake, so they could tell me to move my eyes right or left so they could get it just right. And they completely reattached the tendon of the cartilage on my right eye, and where it started coming off on my left eye, they did that also. It was just right on the eyelid, just left a little scar under each eyelid, and stitches were out on my left one in a week and on my right one in 2 weeks. When I went for my pre-surgery screening, Dr. Rebecca Vandekop, who's my primary care physician, she was like, "Do you know who he is?" And I was like, "No, not really." She's like, "You need to look him up because we're quite lucky, and he's quite well known in his field nationwide." I did a little research on him and found out exactly who he was and how lucky we are to have him in Brookings, since he's one of the top in his field when it comes to ocular surgery. He's like one of the top 5 in the United States, and he has people from all over come to see him. So this was something that was like a cakewalk for him. Dr. Minton prepared me by answering all my questions that I had, and which are mostly the ones that, will it happen again? What is going to happen during the surgery? How long it would be? He told me that all it would take would be the 2 little slices, and they put me under a local, and they gave me an IV with some calming medication in it. And the weird thing was I had to be awake during it, because even though my eyes were covered, he would say, "Okay, right, move right, left, look up, look down," because they had to get the tendon and the cartilage exactly right for that, so he wouldn't have to go in and do it again. The recovery was wonderful. The stitches on my left eye got removed after about a week to 10 days. The right eye, just because it was completely detached, we had to keep them in there an extra week. So it was about 2.5 weeks for that. After that, I went for a follow-up visit, and everything was fine. He took the pictures of it completely done, and checked my field of vision, and did all his little tests with this machine, like how high, and with my peripheral vision and everything. And then that was it. No problems whatsoever. 100% better. I can see, especially in the right eye, my peripheral vision, my up and down vision, it was very limited before on my right side, and now it's back to normal. Plus, people tell me that it made me like 10 years younger once I got it done, because my eye was like pretty much half to 2/3 of the way closed at all times. Dr. Minton and everyone over at Yorkshire Eye was very professional. They answered all my questions. Very friendly, very upfront, just very casual. Everything was at ease, because you're always, even little surgeries, whenever it has to do with your eyes or whatever, you're always just a little bit in the back of your mind worried. They set all my worries at ease before it even happened, and I was just in and out, And that was it. It was just over and done with in a snap.